Any clinical prospective double-blind randomized study needs a verifying physician taking this qualification, otherwise that study wouldn't be legitimated. So this is why we will welcome Mr. Dr. Med Axel Schußmann. He himself is general practitioner and has performed this study. Well, we should ask, why does a general practitioner do this? It's okay to do a study with bioresonance according to Paul Schmidt, and since we know him very much over years, since 2002, Mr. Schußmann has been with us, and we learned he does it because he has, about in all his career as a doctor, what was important to him was to have the best possible support for the patient. The best support is, of course, traditional medicine, conventional medicine, but you need to add something to it to do it well. And this is why he said, I am coming to such a study. So we'll see now how he sees it. This is why I have his presentation now.
Guten Tag, ich begrüße
Good morning. I would like to greet all participants, interested people of this third World Congress of RIANEX. I would like to introduce myself. You know my name, Dr. Schußmann. I have a rural practice in northern Germany, south of Hamburg, for 30 years. And for 20 years, I've been working together with my wife, a naturopathist, which for many conventional doctors is unusual, but to me it's normal. It started, she discovered bioresonance according to Paul Schmidt, and I, as a traditional doctor, was skeptical, as we usually are, with conventional training. But I had to say then I was convinced by this sort of diagnosis, which really was astonishing. It has been continuously improved and become more precise, and also the according therapies, I had a look at them and I saw the success that could be made with it, and this really astonished me and convinced me. So this is how we can combine it very nicely, conventional with complementary medicine, especially bioresonance according to Paul Schmidt, and also the diagnostic system developed by my wife of Nosot. And these tests are extremely precise, and I can say it's really excellent. I've been asked by the company RIANEX to assume a study as a medical director, and I was ready to do it because I like to show my colleagues how to deal with a different medicine than conventional medicine. And to me, it was a very interesting challenge. The study design was chosen in a way that also both the structure and the development would be according to conventional medicine question, in order to be as convincing as possible. This was important, and also RIANEX registered the study with the medical bar in Lower Saxony, and the usual modus is presenting the study and its procedure in the Ethics Commission. The Ethics Commission meets several times for such studies that are usually initiated by pharmaceutical companies, and it's composed of different professional groups, from housewives pastors, lawyers, doctors of different disciplines, 12 members. I was invited. There was a very interesting conversation. I was astonished that even my conventional medical colleagues were interested and asked interesting questions. I explained the general effect of bioresonance, and also they explained the study procedures, and the interest was very big, I have to say. And the general tone was that they were very interested in the result, all of them, all members, and they would like to see such a result in shape of an elaboration. So this was the most important. The main goal was the effectiveness and the safety, that not only rely on the effectiveness and also the safety, that is that there are little or no side effects. So patients were chosen that would possibly feature similar or same disorders. And the patients who were recruited, for instance, through flyers, we have made ads. We need 54 patients who were within the same issue. And there were also patients who registered willingly. Others even didn't know it, and they reacted to ads and social media ads. So we had a swift and nice recruitment. That was good, I have to say. The inclusion criteria of patients, well, they had to be restricted. They should be at least of age. We didn't take any children because it happens very seldom that they have these complaints. They have to be medium pains, not only very little, but I just lifted this much away, and I have some pain in the cervical spine region, but pains that are really a nuisance. The NDI, named here, I will come to it later. It's a survey, inquiry. The patients had to say that they understood the information. We had patients who were not in such a good command of German, because we had patients from many different countries. It was really astonishing, who were partly very interested and had already informed previously themselves about bioresonance. Then the written consent, that's clear. And then we came to the exclusion criteria: acute, massive, inflammatory disorders in cervical spine. We had to exclude them. We didn't want this. We rather wanted to have chronic pain that had been developed over months or even years. Trauma should be excluded when it was a fracture, and this fracture had been treated surgically. That is, other treatment, non-surgical, that, for instance, hernial discal hernia was not exclusion. Then a massive disease like cancer or acute diabetics. But I'm going to talk about these diseases. And also massive limitations of mobility. Patients who had who were even in a wheelchair. Neither did we include pregnant women and in lactancy. Also women who were in a fertile year, we asked them a pregnancy test. Otherwise, we needed to explain them that an effective contraception had been done during treatment. or during the study. Then acute psychological diseases, and drug addiction, and in general patients where you cannot appraise what could occur during the 2.5 or 2-hour sessions. Then persons who work in our practice or who are and have any labor relationship with Ryanex, we didn't take them. Inmates, it would be difficult to have them come to the practice, or participation in other studies should be excluded, so there are no conflicts of interest. At the same time, they said they take drugs, they should go on. Both groups had to take them. Of course, it was recorded, and we introduced this in the computer. The whole study had a follow-up on the computer. All data had to be introduced. That would be validated later. Now, the medical history, it was clear. Previous diseases had to be recorded and inquired. Patients were thoroughly inquired, and it was important that we didn't know before in what group patients would come. Therefore, we didn't make any difference. So the question was the same for both. We said we wanted a long time, chronic patients, not very short, but long, so both groups would be comparable. Inclusion or randomization, that is, the allocation by random, was done after the inquiry. Also, with the therapy, we didn't make any difference between the groups. The medical history still was also asked for. It was noted if some have someone with diabetes, cardiovascular disease, and also spine operations that had been mentioned. And I also had to appraise whether we include them into the study or not, and other diseases. Everything was asked for. This NDI, the Neck Disability Index, is an internationally used test version, so to say. The inquiry, the questionnaire, was to inquire daily activities: driving, reading, lying by night, how the head has to rest. All this was asked very thoroughly, and this also made it very interesting. It's important, before randomization, this questionnaire was produced, had to be filled in, and after finishing the study, it had to be completed again, and a comparison was made. Then pain intensity, personal body treatment. If you dry your hair, can you lift weights, read? Driving, can you park the car when driving back if you don't have any such a modern car with a camera? Do you manage it without bumping into other cars? So this is also, I also had to ask, how is your sleep? Do you sleep through the night, or do you get awake due to headache or pain in the neck, and so on? Then came SF 36. That's a general health questionnaire pointing into the direction of psychological state. How strong are these? Is this chronic pain? For the daily business of family, do you feel affection from your family, or are others just annoyed by the pain you're suffering? All this was entering to the personal aspect, which is also very interesting. And again, before and after the study. General health perception, as I said, physical health, but also psychological, mental health, social intercourse. Do you have still contact with your friends, or do you need to refrain from doing things because of the pain? Then was a so-called visual analog scale. You see, very thorough and exhaustive questioning before and after. This made also the study very complex but also very precise. The visual analog scale, VAS, is a subjective measurement, so you have these smileys from laughing to crying in 10 levels, and the patient should also check at what activities how intense the pain is. Headache, back pain, in muscle tensions in the necks. It also takes it down to the different spine areas, also up into the head. This was a very interesting questionnaire. Well, very clear. And for the rest, we have this test. After randomization, the patients were given an appointment over 12 years within 20 to 90 days. So people had time to come to the appointment, but most did it twice a week. It went very well. We had 17 males, 37 females. It's quite interesting. The waiting, the youngest person was 27, the oldest 84. The identification of devices were A and B. We didn't know what device was a so-called VRM device, in which the placebo device. Patients were distributed exactly half each, 27 persons. So 27 for placebo, 27 for VRM. Then some adverse events, which happily were few or almost none. Of course, the adverse events were reported, like nausea, tiredness, headache, unrest, palpitations. 3 patients had reported in all 10 adverse events. We saw afterwards that it was not due to the product, that is the device itself. It was clearly another cause. Also, the acuteness was very low, so we really could take notice of it, that it was very well tolerated. Well, so thank you very much. I hope you've had a small insight into how such study works. It was very fun, but it was really nice to see how it worked, and we were positively surprised. And I have to say, the conventional medical colleagues just have a look at it and look over your shoulder. Thank you very much. Right, Dr. Schußmann, thank you very, very much. First of all, for the presentation, but there was a reason also, the whole work you took on yourself for carrying out this randomization double-blind study. The questionnaires you've just mentioned was a very special thing, what you're able to learn about it, because they were validated questionnaires, and there are even companies that move in these areas, and only these questionnaires can be taken. Why? Because they have been taken also for different studies and are validated. So the effort was big, as you said, and on behalf of all appliers, applicators, I really want to Thank you. You have created also some tension about the results, but before that, I would like to ask the technicians if there have been some questions drawn in. Please show the first. No? Oh, yes. The question is from Bavaria. Okay, I have my general practice in Bavaria. Can I integrate bioresonance according to Paul Schmidt into my daily practice, or makes it more sense for you to offer specific consultations for the bioresonance therapy? Well, that's a very good question, I have to say, because we also know that for a long time I worked in practice with bioresonance together with my conventional medical practice with home visits. It's really difficult to integrate it into the daily practice business, I have to say. It's probably nicer and more relaxed if you can create a special consultancy for that, because the diagnose is very time costly, and you want to do it very thoroughly, and that's the sense behind it, that you actually have sustainable and very excellent therapy. Then you need to take the time and keep your time free, and creating a consultation hour especially for that. You can do it, for instance, Wednesday afternoon. That's our Doctor Sunday, so you can take some time for such patients. So people even do it Saturday morning, 2 hours. So it makes sense, I have to say. I would recommend it. Many applying doctors also integrate their practice staff, and they integrate this so the general practice business can go on, and they can work with bioresonance according to Paul Schmidt under supervision of the doctor. Yes, the diagnosis is made by the doctor, of course, and they need to take this time, but the procedure of the therapy, to putting the patients at the therapy devices, this can be done by an aide who is knowledgeable about that. So after the therapy units, there is a control to see whether the goal has been achieved, and if not, you need some more sessions, and again a control, and this control is performed by the doctor, and the rest can be done by the staff, definitely. Are there any more questions? Yes. What disease do you believe is adequate for further study? Well, yes, of course, I've discussed that with my wife very often. We have metabolic diseases at the practice, for instance. It would be also interesting to look at a study with diabetics, because I have to mention, perhaps, what to me is very surprising. We have young diabetics and elder diabetics, and I have had these people examined by my wife, and it's surprising how often you find with these patients some issues with the pancreas. Can be parasites, it can be heavy metals, something we even cannot diagnose in conventional medicine, because we cannot extract any sample from the pancreas and a biopsy. The patient wouldn't be very grateful for that. You can't see any parasites in there. Erythema pancreaticum, I know that from Wikipedia or the dictionary, but I never found it, and I could never identify it, but it's often the cause for diabetes, even with the youth. We are there, and they say, how can an 18-year-old athlete be diabetic? And these are some inflammations in the pancreas, issues that hamper seriously insulin production, and then you can come to the actual cause, and we've found really good therapies and some success. So this would definitely be worth a study. Yesterday, I followed the General Assembly of the Vibration Medicine, and I took up the signals that the Association of Vibrational Medicine would like to deal with that. Perhaps I think that I can convey this message, and that they take this up, because it would be great. Precisely, diabetes is just very commonplace, and many patients would be grateful for that. Yes, diabetes is a major issue. It's not only adipositas, it's also other causes, and like any disease, there's always a cause, and you need to get to